Do you want to apply shared decision making to your practice? You found the right video. This video was requested by Grace T. Thanks for your suggestion. If you have suggestions for future videos, please let me know in the comment section. Traditionally, doctors have assumed a dominant role in decision making. Doctors have been perceived as the experts who know best to decide for patients. During the 1980s, the paternalistic approach began to be questioned. For many illnesses, there isn't one best treatment. Doctors began to recognize the personal preferences and circumstances of patients should be considered in treatment decision. Hi everyone, this is Dr. Erwin Kwun. My mission is to help doctors lead a happy and fulfilling life. I publish new video every Thursday on the subject of happiness and success. If you've not already subscribed to this channel, don't forget to subscribe and ring the bell so you're notified first each time I release a new video. Since the patient rather than the doctor would have to live with the consequences of treatment decision, the assumption that doctors were in the best position to evaluate and weigh the benefits and risks was increasingly challenged. New models of treatment decision making were therefore developed. This led to a shift from doctor-centered care to patient-centered care and eventually to person-centered care. Patients want more involvement in decisions about healthcare. Person-centered care is an approach based on the principle of patient autonomy and informed consent. In other words, doctors promote patients' involvement in the treatment decision by putting the individual at the center of care. The patient is fully informed and invited to share information with doctors about their preferences, beliefs, and values about certain treatment and outcomes. Both doctors and patients are experts in their own rights and work in partnership. The doctor brings the clinical expertise of the disease, prognosis, diagnosis, and treatment options. The patient brings expertise of the experience of illness, attitude to risk, social circumstances, preferences, and values. Studies have shown person-centered care improve healthcare outcomes, care quality, patient experience, and reduce healthcare costs. According to Charles and colleagues, there are three models of treatment decision-making. The first model is the paternalistic model. The second model is a shared model, and last but not least is an informed model. And then there are models in between the approaches. The process of decision making includes three stages. The first stage is information exchange, the second stage is deliberation, and the last stage is deciding on treatment to implement. In a purely paternalistic approach, the information exchange is largely from the physician to the patient, and the information discussed is focused on medical. The physician decides on his own or consults with other colleagues, and the decision is made by physicians. In a shared approach, information flows between the patient and the doctor and vice versa. The focus of discussion is medical and personal. The doctor provides all relevant information to support decision-making of the patient. Doctor and patient work collaboratively to reach a joint decision. In the informed model, information flows largely in one direction, from physician to patient. The discussion is focused on medical. The doctor provides all relevant information for decision-making. Deliberation is made by the patient, and the patient reaches his or her own decision. The shared decision-making model may not work in all cases. Some patients are happy for the doctor to make the decision and don't want to be involved in the decision process. The free talk models of shared decision-making is a great way to apply shared decision-making. This has been developed by Erwin and colleagues. It consists of three stages. The first being team talk, second being option talk, and the third stage is decision talk. In the first stage, team talk, the idea is to work together to describe choices, offer support, and ask about goals of your patient. Let's work as a team to make decision that suits you best. In option talk, this is where there's discussion about alternatives using the risk communication principles. Let's compare the possible options. This is where you discuss the risk and benefits and consequences, potential side effects of treatment to the patient. The last stage is a decision talk. This is where the information, preferences, social circumstances of the patient are considered to make a preference-based decisions. Tell me what matters most to you for this decision. This is where the patient and the doctor deliberate and reach a joint decision. Let me give you a working example. Mr. Smith has recently been diagnosed of type 2 diabetes. He is overweight and he likes to eat sweet. So in stage 1, you would work together with Mr. Smith and describe the choices available to him, offer support, and ask him about his goals. You might learn that Mr. Smith wants to lose weight and he's not keen to take medication. In option talk, you can discuss the alternatives using risk communication principles, explaining to the patient the benefits and risks of medication, potential consequences of not taking medication, lifestyle modification. The role of the doctor is to inform the patient and give the patient all relevant information to make an informed decision. In decision talk, the doctor and the patient reach a shared treatment decision. Having considered the risks and benefits of treatment and Mr. Smith's preferences, both of you agree that lifestyle modification is a reasonable treatment plan. Mr. Smith would benefit from support with physical activities to lose weight and a structured education program to incorporate healthy lifestyle changes tailored to the patient's need. Shared decision making is often perceived to be time-consuming, and lack of time is often a barrier. When doctors spend more time upfront with patients to elicit their health beliefs and social circumstances, patients feel understood and are more likely to trust the advice received. This saves time down the road as the doctor can provide quality care with lasting benefits tailored to the individual's need. Better care leads to better outcome. If you like this video, subscribe to my channel where I'm sharing more great videos every week. Thanks so much for watching. Take care everybody. See you in the next video.